Hello, my name is Nick. I'm going to be assessing you today. What's your name?
Brooke,
Brooke, can you tell me your date of birth?
11/22/82.
Okay. Prior to this, we took vital signs. Temperature was 97.8 orally. Respirations were 18. Height is 5'6", and weight is 175. Pulse rate was 80. Okay, throughout this assessment, I'm going to be touching your skin, different parts of my hand, to assess the color, temperature, and texture. Okay, anytime you have questions, just feel free to ask. The skin is cool. Some places, the face, the cheeks are cool. It's warm and dry. It's clean. Even tone. Have you ever had any kind of history with your skin?
No.
Okay. Any scars?
Yes, C-section scar.
Okay. I see you do have moles. Prior to the video, I assessed all skin areas, multiple moles noted throughout, and they are all symmetrical and even in color. Superficial veins are noted. Okay, lean forward for me. I am palpating now the spine. It is noted to be midline. It's equidistant from each scapula. No signs of scoliosis. Okay, you can sit back up. Okay, now I'm going to assess your head. Just going to feel here. No lesions are noted. The hair is curly, brown in color. It's clean. It's evenly distributed. Okay. I'm going to look at your nails now. Nails are clear, clean. Cuticles appear intact. Toenails are the same. Okay. I'm going to look at your face. The face appears symmetrical. Eyes are symmetrical. Nose is midline. I'm going to feel here on the side of your head. I'm palpating for the temporal artery. I feel 3+ pulses bilaterally. I'm going to listen for temporal bruit. Okay, lift up. I'm also going to listen to your thyroid area. And one more time to the temporal region. Okay, no bruising noted bilaterally or in the thyroid region. Okay, now I'm going to assess your TNJ area. Have you ever had trouble with your TNJ?
No.
Okay, open, close, open, close. No clicking noted. Okay. Now, I want you to take your head, tilt down, touch your left shoulder, and to the right. Okay. Look up and down. Any trouble?
No.
No pain?
No.
Okay. If you will look up, I'm going to assess the trachea here. The trachea appears midline. No deviation noted. Okay, swallow. Swallow. Okay, I was unable to palpate the thyroid gland when swallowing. Okay, now I'm going to feel for your lymph nodes. Feeling for the pre-auricular, post-auricular. Let me know if you have any pain during this and I can stop. Occipital, submaxillary, submental, submandibular, supraclavicular, and the cervical chain. No lymphadenopathy noted. Okay, I'm going to look at your eyes now. Okay? You'll look straight ahead for me. Open wide. Okay. Pupils are equal, round, reactive to light accommodation. Okay. Cover your right eye with your right hand. Okay. Keep your head still and follow my finger. Okay, good. Now cover the other eye. Okay, follow. Okay, eyes move easily in all directions. Okay, now if you will, I'm going to get you to read this eye chart. You'll stand for me and stand on the line I have marked for you. Okay, cover your right eye. Start at the top and read down until you can read no further.
E, F, P, T, O, Z, F, D, C, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, C, L, O, P, Z, P.
Okay. Now with the other eye.
E, F, P, T, O, Z, F, D, C.
Okay.
That's it.
Okay. That's good. You can have a seat. Okay. Now I'm going to assess your ears. Have you had any trouble with your ears or hearing before?
No.
Okay. Okay. No nodules are noted and the ear canals are clear. I'm going to look at your nose as well this time. Okay. Nose is midline. Look up. Okay. No nodules are seen. Septum is midline. I'm going to get something to do a smell test. If you will close your eyes, okay. Smell? Without opening, what is that?
Cinnamon.
Cinnamon. Good. Okay. Eyes closed. Smell? Can you distinguish that one?
No.
It's lemon. Okay? Note that there was trouble with the right ear and distinguishing smell. Okay. I'm going to palpate your sinuses. Let me know if you have any trouble. Now I'm palpating the frontal sinuses, the maxillary sinuses, ethmoid sinuses. There are further sinuses deeper, the sphenoid sinuses, but they are not palpable. They are assessed with X-ray. Okay. I'm going to look at your mouth. Open up. Let me see your teeth. Okay. Okay. No cracking or redness, swelling in the lip, gum area noted. Okay. Now, do you do a monthly breast exam?
No.
Okay. Prior to the video, we had talked about doing breast exams and how to do them. For breast exams, you will stand in front of the mirror without a shirt on or your bra and look for any changes, redness, swelling, lumps, obvious lumps. You turn slowly to the right and slowly to the left while looking in the mirror. You'll hold your arms above your head and look up under your breasts as well. Okay? And to assess for any changes like lumps, lesions, you will use a circular motion, move from center to the outside of the body towards the underarm, come back, go one finger down and start again using 2 fingers. Also assess under the arms. Any pain, redness or swelling, you need to tell your doctor, okay? Okay. I'm going to listen to your chest. Deep breath in. In and out. And again. Okay, good to listen to the back. In and out. And one more time. Breath sounds are equal, clear, bilaterally, anterior and posteriorly. Now I'm going to listen to your heart. Listen to the aortic valve, pulmonary, tricuspid, and the mitral. S1, S2 noted. I'm going to listen to your carotid arteries. Hold your breath. Breathe. Hold your breath. Breathe. No carotid bruits noted. I'm going to take a look at your fingers. We're going to assess for capillary refill. Capillary refill is brisk, less than 2 seconds. Now I'm going to listen, feel or palpate for all of your pulses. Okay? I'm going to feel at the same time each side. So far, I have felt at the point of the temporal, the carotid, the brachial, and the radial. Lift up your knees a little there. Yeah. I'm feeling for the popliteal. Posterior tibial and the dorsalis pedis. Pulses are noted equally bilaterally and 3+ at each point. Okay, the patient today has been able to open and close eyes easily on follows simple commands and is oriented, awake, alert, and oriented ×4. So according to the Glasgow Coma Scale, she scores a 15, which is excellent. Now I'm going to assess the cranial nerves. As we've assessed before, we have already assessed the olfactory nerve, which is 1. She had trouble on one side distinguishing the smell, but other than that, no trouble. Have you had trouble with smell in the past?
No.
Okay, no trouble in the past. 2 is the optic nerve, which we will be able to tell color, and is before. We did a little bit of testing in the fields. We're going to do something a little different now. Okay, I want you to cover one eye, right hand, right eye. Okay. Tell me when you see my finger move.
Okay.
Keep your eyes straight to me.
Okay.
Okay.
Okay. Uh-huh.
Okay. Now we're going to swap up and do the other eye. Okay.
Okay.
Movement. Good.
Okay.
All right. Now we're going to change up. Give that one more time. Okay.
Okay.
Movement.
Okay.
Good. She was able to detect movement in all of the fields, 4 quadrants. Okay. Her pupils previously were able to contract easy and briskly to the pin light, so there's no need to do that test again. Eye movement is the 4th cranial nerve, is the abacant nerve. Eye movement is noted to go in all fields, 360 as previously seen. She had no trouble in that area. The trigeminal nerve, I'm going to do a couple of different tests here. I'm going to go get the equipment. I'll be right back. Okay, if you will close your eyes for me, I'm going to touch you at different points on your face, and you're going to tell me, if you can, whether it's a sharp or soft touch. Okay? All right. Tell me where as well.
Right here.
Okay. Was it sharp or soft?
Soft.
Okay.
Right here.
Okay. Sharp or soft?
Sharp. Right here.
Okay. Soft? Sharp?
Sharp.
Okay.
Right here.
Okay. Soft or sharp?
Soft.
Okay. Okay.
Sharp.
Okay, good. It was noted that she was able to distinguish between sharp and soft at multiple points on the face. So the trigeminal nerve is intact. Okay. Now, if you will raise your eyebrows really high. Now down. Okay, smile. Okay, good. What I'm assessing for now is the 7th cranial nerve, which is the facial nerve, and it helps with control of muscle movements, frowning, smiling, furrowing of the eyebrows, and she's able to do all of those. All that cranial nerve is intact, no trouble there. And the 8th cranial nerve is the acoustic nerve, and they're able, normally you would use a tuning fork, but you can also use a whisper test. So I'm going to whisper quietly in each ear and see if she has trouble hearing anything bilaterally. Did you hear me?
Yes.
Okay.
Yes.
Hear me? All I said each side was hello, and she's able to hear each time I speak. So her acoustic or cranial nerve number 8 is intact. 11, we're going to move to 11, which is the accessory nerve. And I'm going to see how well she can shrug against my hands. It's going to show how well it's intact. Lift your shoulders. Okay. Down. 1. And here. Good. She can move, has good strength bilaterally, equally in each shoulder. She can move one or the other on command. No trouble there. Okay. Okay. Number 12 is the hypoglossal nerve, if you will. We're going to assess with this by sticking your tongue out. Stick your tongue out. Move to the left, right, up, down. Good. She has good control and movement upon command. So she has, with this, it shows that their hypoglossal nerve is intact. Now we're going to assess for muscle strength. Okay. If you hold your arms out, okay, pull up against me. Good. Pull, 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 pull. Okay. Turn your hands around and push. Give me a push. Good, good. Okay. Extend this leg. Okay. Now don't let me push it down. Okay. Good. Now bend it down a little, and then don't let me pull it up. Okay. Good. And here, come back up. Push against me. Don't let me push. Okay. Good. And then pull against me. Don't let me pull it back up. Pull, 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 pull. Good. All right. Her muscle strength is good, noted bilaterally and throughout. Now I'm going to test a couple more things. Going to palms out, up, close your eyes. Take your pointer finger of your left hand and touch your nose. That's good. Okay. Take your pointer finger of your right index finger and touch your nose. Good, good. Now, for this next test, I'm going to ask you, if you will, to stand for me. Okay, just stand directly in front of the couch there. I'm going to turn this way. Turn to me. Feet together. Okay. Close your eyes. Ooh. 1 second. Stay over there. I do apologize. I have been using a clock on the wall, but I'm going to use a watch for this. What I'm going to do is see how well she can maintain her balance with her eyes closed during the Romberg test, okay? And close your eyes. A normal amount of, little bit of swaying is normal. It shows that her sense of balance is intact and she's correcting any swaying movement to make sure she stands in the erect position. Okay? Good. For this next one, what I want you to do is to hold out your arms, palms up. Extend your arms all the way out. Good. Now close your eyes. Good. Now keep them closed. Keep your arms extended. Straight out. Good. It's normal to see the arms come back slowly, back to the original position. That's good. You can have a seat. Okay. I'll lay the watch here. let's see here. Okay. If you will lay back just a little bit for me, just in a relaxed position. Good. And now I'm going to listen to your abdomen. After I listen to your abdomen, I'm going to press on it. If at any time you feel any discomfort, let me know. Okay? Upon auscultation of the abdomen, it was noted that in each quadrant, I heard bowel sounds, active bowel sounds. No bruits were noted in the abdomen. Bruit could be a sign of an aortic aneurysm. Or now I'm going to press on the stomach, and it's important to listen to the stomach prior to listening, because depressing anywhere on the stomach can make a false sound or active sound when you listen that would not have been there otherwise. Any pain?
No.
Okay.
No.
Okay. No pain?
No.
You ever have any trouble with your stomach before?
No.
Any stomach problems? No. Okay. Now I'm going to look for is, we're going to assess for edema. Edema can be in multiple areas. Oftentimes it's in the lower extremities. It could be associated with cardiovascular problems. Prior to the assessment, the sacral area was assessed and was found to be free of edema or swelling, no redness, skin breakdown. Okay, I'm just going to press throughout. No edema was noted throughout, either bilaterally in the upper or lower extremities. Have you ever had trouble with edema before, swelling of your hands or feet?
No.
No? Okay. Now I'm going to assess for reflexes. If you can sit up for me. Good. Just relax here. I'm going to assess the bicep, the tricep, and the patellar reflexes bilaterally. You notice the slight jerking movement. It shows that I did hit the bicep, and it shows a positive response, which is good. Okay, here. And slightly bend the arm with the palms facing upward. Again, you can see the hands, the forearm, lower arm move with each strike of the hammer. Okay. Just relax. You can see that with the strikes that the lower arm or the forearm moves upon striking. Okay. And relax. There we go. That's a good reaction there. Okay. Now, if you will, scoot up to the edge of the couch. We're going to assess for the patellar reflexes now. Okay. I'm going to support your leg and relax. You can see the extension of the leg upon striking the patellar tendon, which is good. And relax. There we go. We got a good positive reaction there. That's good. Okay, and that concludes our test. Thank you.